What's going on, Tangelinos? Sean here. We're at our Seattle Green Lake location, and let's talk about the lower back, shall we? Now, I want to address this first part of the video to all the lawyers out there. Two people that have similar symptoms of pain may have very different sources of pain. The most responsible thing to do is go see a medical professional before you attack your lower back with exercises. With that being said, this video is all about giving you value. So let's just jump right into it. The first exercise that we're gonna talk about goes into making sure that you're proficient with something that you do 25,000 to 28,000 times per day, and that's breathing, okay? So if we want to look at how we're breathing, the best thing to do is to do it on the floor, laying on your back. The reason why is you're able to apply some tactile feedback with your hands, but you also get that from the floor. Now, when you're breathing, what I want you to do is just close your eyes and take a few deep breaths. Just take a few deep breaths here. And exhale. Now, put your hand on your chest, put your hand on your belly, and a few more deep breaths. If your right hand is on your belly and you don't really feel that right hand move at all, and you feel all the movement going into your left hand, that's a problem, okay? Now, when you breathe, your chest is going to move a little bit. That's okay. But with diaphragmatic breathing, which we're gonna go into, you wanna make sure that you're breathing three-dimensionally around the abdomen, around the lateral core, and the posterior core. So the best thing to do there is to put your hands on the lower rib cage, close your eyes, and work on inhaling through the nose and exhaling through the mouth. And with each inhalation of air, you should feel the rib cage expand out into your hand. That's how you know that the diaphragm is contracting. And the diaphragm, it's kind of a plunger-shaped muscle. It flattens out, and that expands the rib cage and allows your lungs to descend down and thus fill up with oxygen, okay? If you're only breathing from the chest, what you're doing is you're inadvertently putting your lower back into 25,000 to 28,000 extensions per day, which can trigger tightness in your lower back and can lead to pain down the road. So if you want to address the core 101 is looking at your breathing, okay? Now when you exhale, you want to make sure it's a nice robust expiration of air. So just like that, and almost like envisioning trying to blow up a balloon with one pass. I don't recommend spending 5 minutes doing deep inhalations and deep expirations of air because you might feel a little lightheaded. Just go through like 5 breath cycles. Plus, it's relaxing, so it's a great thing to do, especially as you wind down for the evening, okay? Address your breathing before you address anything else. The next thing we're gonna do is we're gonna work on what's called cat-cows. They're a classic for a reason. When we sit, we often think that sitting leads to tightness in our hip flexors and our lower paraspinals, our lower back erectors. Now, that can be the case, but it's not always the case, because I don't know about you, when I sit down, I'm sitting down for long periods of time, I'm not sitting down where I am kind of extended or hyperextended my lower back and my hip flexors are shortened and my erectors are shortened. When I'm sitting down for a long period of time, I tend to kind of default into a rounded position here as I work on the keyboard. Now that is probably your case as well. When you do that, your lower back is actually stretched out. And because you're shortened more than the hip flexors, it's really your abdominals that are shortened and not so much your hip flexors. That being said, it might behoove you to strengthen as opposed to stretch, okay? Now, before you work on building strength around your lower back and your hip flexors, you want to look at just your mobility through the pelvis, and that's where the cat-cows come in. It draws awareness to a potential dysfunction. If you can draw awareness to it, you can correct it. So what you're going to do here is you're just going to time the pelvic motion with your breath. So as you inhale, you're going to draw your belly button up towards the ceiling, rounding your pelvis back, okay, or going into what's called a posterior tilt, and then you're going to exhale drawing your belly button down towards the floor, and then going into an anterior tilt. And just going through that and feeling if there's any discrepancy as you go through each motion. Is it hard for you to get to the posterior tilt? Do you feel stuck and do you want to just kind of throw your upper back into it? Do you feel stuck in going into the anterior tilt? There, and then you start to like shift forward. Drawing awareness to it allows you to change that, okay? Now, how you change that might differ. You might need to see a medical professional to help you with that, because it might not just be muscular. There might be something going on in each of the vertebrae themselves, okay? But going into it really helps you discover any breakdowns that might be occurring. Plus, it's just a great way to kind of reset everything, and like the diaphragmatic breathing, it's really relaxing, okay? Now, a common question that I get is, well, I was taught to exhale when I round, so exhale here and inhale here. It doesn't matter. As long as you feel comfortable with it and you're able to have that mind, muscle, brain, body connection to how your pelvis is moving through space. The last thing we're gonna go over is the hip hinge. So the hip hinge, as you know, or you will know now, is the most functional movement we do through our whole lifetime. Whether we're 18 months or 81 years old, we should have the confidence to be able to do a proper hip hinge. Now, if the hamstrings are shortened, again, due to maybe prolonged sitting, that's gonna impede your ability to weight shift back and load your hamstrings and glutes. And to compensate from that, your lower back might get involved, can lead your lower back into a precarious position where you can fall into pain down the line. So with the hip hinge, you're gonna set up, feet directly underneath the hips, feet pointing straight forward, and then from here, you're gonna have your hands on your thighs, pretend like you're holding a barbell in your hand, have a soft knee, and then think about this, push hips away from heels, okay? So as you push your hips away from your heels, you wanna go back until you feel a little bit of a stretch in your hamstrings. If you feel the tension here, rest assured that the tension is probably not here. That's a good thing, okay? And then come back up. Here, push hips away from heels, bring your chest down to the floor. Wherever your chest goes, your chin will follow. Meaning, as you go down, I don't want you looking up for this one. I want you to pretend like you have a tennis ball resting between your collarbone here and your chin as you go through the motion. Pushing hips away from heels, go back until you feel that tension in your hamstrings, and then come back up. Now, feeling it a little bit in your lower back is fine, but there should be a stark difference between feeling like the muscles are working and feeling tightness and pain. If you feel tightness and pain, don't do it, okay? You should just really feel the tension, the stretch in your hamstrings. What you're doing there is you're loading that spring to allow you to return to that starting position safely and with power, okay? Those are the 3 exercises to help you if you're experiencing some lower back discomfort. Again, the best and most responsible course of action is to go see a physical therapist, go see a chiropractor or a sports medicine professional. If you live in Green Lake, if you live in Fremont, West Seattle, or in the Portland area, Tangelo is in your neighborhood. Come see us, we'll take great care of you. See you in the next video.